My name is Molenaar. I'm a physical therapist at Holland Hospital. I work in outpatient rehab and I specialize in pelvic floor dysfunctions, and we're here to talk about pelvic floor health today. Your pelvic floor is a group of muscles that sit in the bottom of your pelvis. So from front to back, they run from your pubic bone to your tailbone, and from side to side, they run from one sit bone to the other. Often, as women age and we go through menopause, because of the hormone changes, our muscles tend to atrophy a little bit during those times. So they basically lose some strength. They tend to thin out a little bit, and then it makes it harder to then control your bladder or your bowels, and then we run into some issues like leakage or more prolapse where those organs drop a little bit, or sometimes even just dryness down there, and then that can contribute to some pain with intercourse or any kind of friction against those tissues, because these muscles play a role in women, at least helping to erect the clitoris. These muscles help to relax well to allow for vaginal penetration, and also these muscles contract when we have an orgasm, and so if these muscles are weakened, potentially you may not have as intense of an orgasm that could happen. So pelvic floor therapy is often great during those times or even before that, so that you can kind of get started with the whole process before you end up there. You can actively work on strengthening these muscles by doing those Kegel exercises, if you've heard of those. And what that is a contraction of your pelvic floor muscles. So I often tell a lot of my patients, imagine you're stopping your flow of urine, or pretend like you're stopping yourself from passing gas. Or if you imagine there's an elevator, you're going to close the doors and they're going to go upstairs. So it's both a closure and a lift of these muscles to help strengthen them. And once you're able to find them, you should be able to work on holding them as well. So don't just turn on and off. Be able to hold for up to a 10-second count to be able to keep these muscles strong and healthy for you. Some other preventative measures that you can do besides Kegels include taking a peek at some of your behaviors throughout the day. Are you doing all those just-in-case pees where you really don't have to go, but before you run to the grocery store, you feel like you have to use the restroom? Or before you get in the car for 20 minutes, you feel like, oh, I should think about going one more time. That kind of trains your bladder then to not be able to hold as well, and then we end up with some poor habits. If you take a peek at what you're drinking on a day-to-day basis, water is your bladder's best friend. If you're having a lot of coffee, teas, sodas, those things potentially could irritate your bladder, and then you end up potentially being at more risk for incontinence or urgency, meaning like you can't get to the toilet in time. So pelvic floor physical therapy can help you not only be able to identify how to do a correct Kegel contraction, but then how to strengthen these muscles appropriately. So we work not only just on finding them, but also we look at your hip and your core muscles and how well you're engaging those muscles to help support your pelvic floor organs and your muscles down there. Because often weakness in your abdominals sometimes can contribute to some pelvic floor weakness. So we can kind of take a big picture of everything and specifically focus on what's your deficits and hopefully work on that to help reduce some leakage or help support those organs better. Pelvic floor physical therapy is great for women at most ages. I've seen anybody from 18 all the way up into their 80s, 90s. Often it's heard about a lot more postpartum because women have often had some trauma with either a vaginal or even a cesarean delivery. These muscles sometimes need to relearn how to work and help support those muscles better. If there was potentially a tear during delivery and they had to be stitched up, sometimes that can be a little uncomfortable when resuming sexual intercourse, and sometimes that can be addressed as well with physical therapy. So it's great for most women. I think it's something that we should all go through a little bit just to learn how to use our muscles well to help support our bladder and our bowels and our sexual function over time. Know that you're not alone. A lot of women deal with a lot of these issues, and they're very hard to talk about sometimes. It can be often quite intimate and embarrassing sometimes if you're leaking or if you're not being able to enjoy intercourse, and having that conversation with your physician is sometimes difficult, but I would encourage you to do it because you're not alone, and there is something that you can do to help improve these symptoms.